Hey, it's Dr. Randall with Utah Orthodontic Care. Today, I want to talk to you about how to take care of common orthodontic emergencies at home, or if you're traveling, how you can fix something until you can get back into the office. I want to talk to you about poking wires, how to fix those, or a broken bracket, what you should do with that, or a wire that's slid around, or even a wire that's come out of the back molar tube, how to fix that. First thing we're going to talk about is a poking wire. You've got a wire that's poking you in the back for whatever reason. A lot of times what will happen, especially in the beginning of treatment, as the teeth move, your teeth straighten out and the wire by design gets longer out the back and you need to get that cut, but you can't get in here to get it cut. So I'm going to show you how to cut it. It's easy to just find either a pair of wire cutters that you have at home. Sometimes even fingernail clippers will work, but you want to clean it as best you can. This is an alcohol wipe where you would try and clean it. Even hot water is going to help, but it's not like you're doing surgery or anything. You're not going to be cutting any. It's not going to get in the blood. Just try and get it as clean as you can. And take the flat end of the plier and get it as close to the edge of the bracket as you can, and just cut that wire, and you'll see that that piece is going to fall out, and it'll fall out in the mouth, but just find it and take it out. And I know it looks easy here because I'm doing it on the model, and when you're doing it at home, you've got the cheeks, you've got saliva, but do everything you can to just move the cheeks away, pull the cheek out, and get the wire cutter close, and you'll be fine. You won't cut anything, no one will bleed. It'll be easier than you think. Sometimes though, you're left with just a tiny little poking wire. That's when it's a good time to use the wax that we give you. You take a little ball of wax and you just pack it over the end of that wire and make it so it's nice and smooth until you can come in and get it cut. Sometimes though, wax doesn't stick very well because the wax it's got to be really dry. So dry off the tooth as best you can, or even better, find some sugarless chewing gum. Make sure it's sugarless, but chew it up, get it nice and soft, and then just pack it around the poking wire, and that will help so you don't feel that sharpness until you can get in and have it fixed. Next thing we're going to talk about is a broken bracket. So what we mean by a broken bracket is when the brace has become separated from the tooth and it slides along the wire like that one. So if a bracket is sliding along the wire and moving around, and if it's just staying there and it's not really causing you any problems, it's fine to just leave it like that. It'll move around a little bit, or sometimes it's a little tighter, but it's fine to just leave it like that until you can get in and we can reattach it. Or you can try and take it off so that it's not bothering you anymore. Probably the easiest thing that you would have at home would be like a safety pin. But any kind of pointy instrument like this would do that you might have in your toolbox. You've got to take the little rubber ligature off, and you just kind of tease it off. And once that's off, it's easy just to move that bracket out and take it off, and you can save the bracket, and we can reattach it when you get back into the office. Next thing we're going to talk about is a wire that has slid around right or left and is poking in your cheek, which sometimes happen for various reasons, but again, really easy to fix. It's an option to cut the wire like we talked about with wire cutters or with fingernail clippers, or if you can get some needle nose pliers, and from the front, it's really easy just to grab a hold of the wire, even between the bracket like this, and slide it around. Just slide back and forth like this, and you can see the wire sliding over till it's comfortable in the back. And it's important, the wires being aligned are important, but when you're fixing it at home, just slide it over until it's comfortable, and then when you come into the office, we'll be able to fix it so it's doing what it's supposed to. Last thing we're going to talk about is when a wire slips out of the bracket in the back. It happens, especially in the beginning when we have softer wires, where food or whatever you're eating can push down on that wire and just make it slip out of the back like that. It's very easy to take tweezers, just tweezers that you might have in your bathroom, and grab the wire and guide it right back into the slot so it's comfortable and nice and secure. And then we can fix it and make sure it's right next time you get into our office. So there we have 4 simple solutions to common orthodontic problems. But always remember, you can call and talk to someone at our office 24 hours a day. And if you need to, you can set up a virtual appointment with one of our doctors online so they can look at your problem and talk you through it. Thank you for choosing Utah Orthodontic Care.